Preconception care is much needed but less talked about. Journey of the first 1,000 days of the child is the foundation for a brighter future. The embryo begins to start develop at the same time before she even knows that she is pregnant. All major organs develop in first 2 months of pregnancy. Brain and heart are first to develop. So major birth defects can occur during this period. So the womb may be more important than the home. What is preconception care? It is prepared to care and create. Why it is needed? Because 10% pregnancies are unplanned and undernutrition in women leads to increased maternal deaths and death of baby around birth. Unplanned pregnancies in young adults lead to BOH and IUGR. Lack of screening leads to birth defects. Undiagnosed diabetes mellitus and hypertension leads to preterm deliveries and intrauterine deaths. Effect of environment leads to PCOD and infertility. Stress impacts on genetic configuration of fetus. There is lack of knowledge of adverse effects of medications on fetus. Before getting pregnant, mental well-being should be assured. Screening of anxiety, depression, suicidal tendencies, and stress management should be done. Educational and psychological counseling should be done before and during pregnancy. Counseling, treating, and managing depression should be done by multidisciplinary approach. Signs of marriage in danger are lack of intimacy, continuous criticism, abuses, infidelity, and financial issues. Certain diseases can be prevented by vaccinations. Recommended vaccinations are MMR, Tdap, influenza, hepatitis B, COVID, and vaccine against human papilloma virus. Nutrition is very important as it is going to affect the future generation. That is the first 1,000 days of human life. It should be started at least 3 months before preparing for pregnancy. Take balanced diet, maintain ideal BMI and hemoglobin, avoid junk food, and take regularly 400 micrograms of folic acid daily. Adequate water intake and intake of macro and micronutrients. Healthy diet leads to healthy ovum and sperm and therefore healthy baby. So, to summarize, avoid teenage pregnancy. Ideal age is between 20 to 35. Always best is to have planned pregnancy with 3 years spacing before conceiving. Use contraception for then pre-pregnancy you should get for screening for hypertension, diabetes, polycystic ovarian syndrome, thyroid functions, etc. Take folic acid supplementations, maintain ideal weight, correct the anemia. Screening should be done for HIV, AIDS, STDs, infections, and genetic disorders. Avoid self medication and herbs without prescription. Avoid substance abuse like alcohol, tobacco, marijuana, and avoid environmental toxins, and there should be good interpersonal relationship. Financial aspects should also be taken care of. Give your doctor details from past history, any medical illness, any abortion, fetal loss, or infant death, or birth defect, or low birth weight, or preterm labor, or previous cesarean section, or any uterine abnormality. So, friends, to make a difference in someone's life, you don't have to be brilliant, rich, and beautiful or perfect. You just have to care.